Peds Patrol here, and the Beyfortus vaccine is in Canada. Here are some frequently asked questions that you need to know about. So 1, what is Beyfortus? So it's an immunization that's used to treat and reduce the risk of respiratory syncytial virus, otherwise known as RSV. It's going to replace Synagis or palivizumab, which is another immunization that we used to give. So unlike your routine childhood vaccines, which could be either live or dead vaccines, or your COVID vaccines, which are mRNA vaccines, Beyfortus is an antibody, and it's a passive antibody because we're giving the child the immune system boost necessary to fight off and ward off against RSV. This means it gives the baby and the child already a really good strong defense system if ever to get the viral infection. Number 2, if you get the vaccine, how long does it last? Well, it can last for up to 6 months of duration, which just happens to be the winter season or the RSV season, usually from October to March of April of each year. Number 3, what about Abrisvo? So you may have heard of Abrisvo, which is a vaccine given to seniors and pregnant women. This vaccine also helps reduce the risk of RSV infection as well. So any pregnant woman that's between 32 to 36 weeks of gestation and having a baby delivered during RSV season is eligible for this immunization as well. So as a family, you can decide to either get Abrisvo or Beyfortus, one or the other. You don't need both. That being said, Beyfortus is actually a better choice for the child's protection, but if you want, as a mom or a parent, you can decide to get Abrisvo instead. Number 4, who is actually eligible for this immunization? So if your child was born in 2024 and less than 8 months of age, they would be eligible. If your child was born between 2024 and 2025 during the RSV season, they are also eligible. And if your child is up to 2 years of age and is in their second RSV season and they have complications, so for example, chronic lung disease, trisomy 21, they have congenital heart disease, airway anomalies, or diseases like cystic fibrosis, they also are eligible as well. Finally, last question, where can you get this immunization? So you can check with your public health unit on their website. Otherwise, it will be available in most family doctors' offices as well as community pediatricians' offices. Some nurseries in the hospitals, as well as neonatal intensive care units across Ontario, will also have it available in the hospital before your child leaves. As always, ask questions, inquire about this immunization, as it can be quite helpful and preventative.